Good, happy Thursday evening, May 14, 2020. I'm Riley King, and thank you for joining us for this evening edition of the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Thursday evening, so let's begin. First up, New Hampshire unemployment rate likely 20%, officials say. Nearly 9,500 new unemployment claims filed. Let's take a listen to that video from WMUR News 9, Ray Brewer.
Some work can't stop because our communities need you, which is why we're working to keep you working.
Latest numbers continue a trend that started over a month ago. For the week ending May 9th, about 9,500 people filed new claims for unemployment, a decline in initial claims from the prior week. But they are still numbers that would have been considered unfathomable before the pandemic hit, when the state saw far fewer than 1,000 claims a week.
The week prior, we were at 642 initial claims. So, again, kind of a reflection of the changing reality.
Over the last 2 months, the state has paid out $400 million, again, a historic amount.
And it's more than we paid out at the highest benefit year during the Great Recession.
This week saw some sectors of the New Hampshire economy begin to reopen, but Laver says it's too soon to say if that's having an impact on unemployment filings. But he does have a message for those returning to work.
When you start working full-time, you are no longer eligible for unemployment benefits. It's not when you start receiving full-time wages, it's when you start doing full-time work.
And those working part-time need to remember to report hours and earnings. But he also says if you're worried about returning to work because of valid concerns about COVID-19, there is relief.
Because the state has an active stay-at-home order, unemployment benefits continue to be available to them.
However, he notes that your employer does not have to hold your job for you. Laver says we should get a clearer picture of the state's unemployment rate when the numbers come out on Tuesday. But again, he predicts that rate will be around 20%. In Manchester, Ray Brewer, WMUR News 9.
Okay, and there you go on that video and that report. And now let's take a look at your COVID-19 in New Hampshire information, what you need to know. And here is a look at that information for all of you. There are 3,299 number of people in New Hampshire have tested positive for COVID-19. 1,388,000 number of people in the United States who have tested positive in the United States for COVID-19. 150 number of people have died of COVID-19 in New Hampshire. 326 number of people who have been hospitalized with COVID-19 in New Hampshire, and 83,715 number of deaths from COVID-19 in the United States. This map of New Hampshire shows you current cases of COVID-19 in New Hampshire. Manchester has 471 current cases. This map of New Hampshire shows you total cases in New Hampshire. Manchester has 750 total cases. Let's take a look at these three charts here. Let's start with new cases each day in New Hampshire. In the purple, daily new positive COVID-19 cases. In the orange, new hospitalizations. And in the red are the deaths. Let's look at the current cases. In the purple, total current COVID-19 cases. And in the orange, current hospitalizations. And your total cases. In the purple, total positive COVID-19 cases. In the orange, total hospitalizations. In the red, deaths. And in the blue, recovered. And this chart shows you by age group. This chart shows you by female and male. And this chart shows you by risk information. This chart here shows you by race/ethnicity of cases. And this chart here shows you percent of New Hampshire population. And again, your common symptoms: fever, lack of smell, cough, chills, and difficult breathing. How it spreads, and prevention tips. Be sure to stay with the Riley King Network for the latest of your COVID-19 information. Live on News 9 at 5:30 p.m., Reps Custer Pappas answer viewer coronavirus questions. That's going to be happening at 5:30 p.m. on WMUR News 9. Governor Baker sets new coronavirus testing goals. Stop short of universal testing. Briefing also included update on PPE purchases from China. Let's take a listen to that video from WCVB Boston.
Brigham Health is working around the clock to defeat COVID-19. You can help our efforts by giving to our response fund, donating supplies, or hosting a fundraiser. We're stronger together. Learn more at bwhgiving.org/help.
Governor says he wants to ramp up to 45,000 tests per day by the end of July. He wants that number to be 75,000 by the end of December. He says universal testing has limits, so he plans to focus the testing in higher risk places.
We'll focus particularly on communities with low testing availability, hot spots where we're seeing high positive rates, and high density areas.
He says he is also expanding the criteria for a test to include both a symptomatic person and close contacts of confirmed cases. The DPH has done that. The governor also saying he does need help from the federal government. He plans to be submitting his plan by the end of the month in order to get those resources from the feds. We're live here at the State House. Sharman Sacchetti, WCVB News Center 5.
Okay, there you go on that video and that report. Maine CDC reports 3 new coronavirus-related deaths, 50 new cases. Let's take a listen to that video from WMTW News 8 Maine.
The New Hampshire Department of Corrections has immediate openings for corrections officers. Apply today.
There are now 1,565 cases of COVID-19 here in Maine, with 50 new cases reported today. 3 more people have died. That brings the total now to 69. 958 people have recovered, so that means 538 cases here are active right now in our state.
Okay, and there you go on that video and that report. Coronavirus news. What you need to know about plans to reopening the Jersey Shore for Memorial Day weekend. New Jersey beaches and boardwalks will be open in time for Memorial Day weekend, Governor Murphy announced on Thursday. Beaches can open on Friday, May 22nd, though crowds will be limited, Murphy said. Boardwalk restaurants must be takeout and delivery only, and amusement park rides, games, and playgrounds must stay closed. Showers, changing pavilions, and restrooms should be open. Murphy also urged towns to set limits on the amount of daily beach goers they sell. badges they sell. The governor gave considerable leeway to local officials in reopening their beaches, refusing to set a uniform occupancy limit, instead letting individual towns decide how much is enough as they prepare for visitors eager to get sand between their toes. Among them was Etchhurt, a Hillsborough woman who came to the beach in Belair earlier this week to let her 2-year-old son Logan run around on the boardwalk and in the sand. Murphy issued his long-awaited guidance the day before two of the state's most popular beaches planned to reopen. On Friday morning, Point Pleasant Beach and Seaside Heights will begin allowing people back on to the sand in a phased reopening that officials in both towns characterize as experiment. In Point Pleasant Beach, the municipality-owned Mainland Avenue Beach will open. Once it reaches a certain capacity, which officials have not publicly announced, no one else will be allowed onto the sand. Masks will be encouraged while standing in line to buy badges, but won't be required once on the beach. The borough will restrict parking to residents only for much of the area near the beach to discourage large crowds of tourists from coming. Murphy suggested such as a tactic in one of his briefings earlier this month as a way to keep beach crowds manageable, at least at first. Seaside Heights, famous as the former home of MTV's Jersey Shore show, will reopen on Friday with some substantial restrictions. Activities on the beach are limited to walking, jogging, activity, surf fishing, and surfing, no swimming, beach chairs or blankets, and no sitting or standing. Ocean City beaches and boardwalks have been open in recent days for exercise and activity restrictions, recreation stuff as well. Palm hurdle set on the boardwalk of Blair's boardwalks beaches have been removed and worried what this summer will look like. On Wednesday, Murphy announced reopening of some non-essential businesses across the state. Governor Larry Hogan. Maryland's reopening will begin at 5 p.m. on Friday. Let's take a listen to that video from WJLA ABC 7 News.
At 5 o'clock in the evening on Friday, but parts of our area will not be included in this.
That announcement within the past hour is the latest of 3 major moves today affecting our area. In the district, the stay-at-home order is now extended until June 8th. And while Virginia will reopen Friday, Northern Virginia will not. It's a similar story for parts of Maryland as well. ABC 7 has team coverage tonight from all 3 jurisdictions. We begin, though, with Maryland Bureau Chief Brad Bell with what will and what won't be back open come Friday. Brad?
Yeah, the governor talked for about a half an hour, ended just a short time ago. He had said that he's looking for, a 2-week plateau or decline primarily in hospitalizations, and we in Maryland have reached that, so he did make the announcement that stage 1 of Maryland's reopening will begin. And so, Friday night at 5 p.m., the stay-at-home order will be lifted. People are going to be urged to understand that they are still safer at home, but they can go out. And also, Friday at 5 p.m., all retail stores may open at 50% capacity. Manufacturing operations can also reopen, but of course, people in those buildings need to practice social distancing and practice all of the safety things, masks and everything that we have learned. Barbershops, this is a big one. Barbershops, salons, and pet groomers may reopen. And churches can now begin to hold services indoor once again at 50% capacity. Now, the governor also stressing that while this is moving ahead for much of the state, our local jurisdictions, Montgomery, Prince George's, who have expressed concerns and are not yet ready, they will have the flexibility to slow their reopen. The governor says we are just not out of the woods yet.
It does not mean that we are safe or that this crisis is over. Low risk does not mean no risk. All Marylanders, particularly those older and more vulnerable populations, are advised to continue staying home as much as possible. Employers.
The governor stressing, look, we still have to keep wearing our masks. We've got to wash our hands. We've got to use hand sanitizer, and we have to continue to practice social distancing. Now, the governor is giving flexibility, as we reported yesterday, to the local jurisdictions, Prince George's County, Montgomery County, accounting for a huge percentage of the cases in the state, and they will have the flexibility to slow down their steps towards reopening. Now, we expect to hear from Prince George's County Executive Angela also Brooks tomorrow. Again, the reopening doesn't kick in until Friday night at 5, so tomorrow we're going to hear more about what the local jurisdictions plan to do. But big news from Governor Hogan. He says, thanks to people's sacrifices, this disease has been slowed, and he believes, though it was a tough decision, that the state can move ahead. At the State House, Brad Bell, ABC 7 News.
Okay, and there you go on that video and that report. So again, Maryland Governor Larry Hogan said that his state will start to reopen on Friday at 5 p.m. NCDHHS launches list of COVID-19 testing sites as officials continue to increase testing. Here are the latest updates about COVID-19, the disease caused by the novel coronavirus in North Carolina. At 4:10 p.m., 2 more COVID-19 cases have been reported in Halifax County, raising the county total to 177. So far, the county has seen 1 COVID-19 related death. 1,773 patients have recovered, according to Halifax County health officials. Cooper also said as North Carolina works to meet its testing goals, officials have also said to consider how well the state is succeeding at following Metro's COVID-19 like syndrome emergency room visits, triage of new COVID-19 cases, and percentage of positive tests and total number of hospitalizations. NCDHHS Secretary explained that North Carolina is succeeding in all of those areas except triage of positive tests, which continue to increase. Over 43,400 cases of COVID-19 in Florida. Death toll climbs to 1,875. Let's take a listen to that video from WPBF News 25. Okay, we're having technical difficulties with that video player. That video is not available. We are getting word in our control room. Sorry about that one. According to the Department of Health, there were 43,210 total cases of COVID-19 in Florida as of Thursday. At least 1,875 Florida residents have died. And happening right now, Los Angeles County officials provide update on COVID-19 response. If you want to watch that, we will share the link with you on the Riley King Network Facebook page right after this broadcast. As revenue plummet, Governor Newsom proposed cutting $6.1 billion for California's budget. California Governor Gavin Newsom is proposing to cut $6.1 billion from the variety of programs as part of next year's budget. He says the budget prioritizes public education, public health, and public safety. Newsom's Thursday forecast estimates unemployment will climb to nearly 25%. And tax revenues will drop about a quarter. Newsom plans to tap the state's $16 billion rainy day fund over 3 years after a record budget surplus that allows the programs to grow. Newsom says it breaks his heart to have to make cuts. This is a developing story. We will keep you updated as more information on this comes into our newsroom. And now let's take a look at that U.S. stock market and see how your U.S. stock market closed for this Thursday evening. And here's a look at the U.S. stock market for all of you. Your Dow Jones Industrial Average closed in the green and went up. Your Nasdaq closed in the green and went up. S&P 500 closed in the green and went up. Gold closed in the green and went up. Oil closed in the green and went up. U.S. 10-year closed in the flat. And Euro/USD closed in the red. And VIX closed in the red as well. Dow jumps more than 300 points to snap a 3-day losing streak. Bank shares rise. Stocks rose on Thursday as gains in bank shares and the oil market offset another decimal round of U.S. unemployment data. Trump challenges Fauci on reopening the country. Let's take a listen to that video from ABC News.
Good evening, and it's great to have you with us here on a Wednesday night, and it's the anxiety being felt across this nation, really the dilemma of being faced by so many. The millions of Americans who do want to get back to some sort of normal, get back to work, but who are also worried about their health. And tonight, just 24 hours after Dr. Fauci was asked by senators about reopening the country, Dr. Fauci saying if we're not very careful, there is a real risk you will trigger an outbreak you may not be able to control. Tonight, President Trump now saying, I was surprised by his answer. He said, to me, it's not an acceptable answer, especially when it comes to schools. President Trump saying Dr. Fauci wants to play all sides of the equation. But of course, all of these are important questions to ask. Will our school children be safe in the fall? Will American workers be safe in the coming weeks as we now prepare to ease restrictions in at least 48 states? And all of this with the death toll rising, more than 83,000 lives lost in this country. Tonight, the internal government document reportedly showing spikes in several parts of the country, Tennessee, Iowa, Kentucky, among other places. Across the country, states now imposing a patchwork of rules to try to control any new spread. Los Angeles County, for one, now saying some stay-at-home orders may stay in place until August. New questions about protecting American workers and children, of course, that dangerous condition many doctors believe is linked to the virus. New York now investigating more than 100 cases. 3 children have died. Cases now in at least 16 states tonight. The president was also asked about this as well this week, about children, whether they're safe as we now reopen the country, and we'll guide you through it all. A very busy Wednesday night, and we're going to begin here with our chief White House correspondent, Jonathan Karl.
Another sign of the times. Vice President Pence arrived at the White House today wearing a mask. He's been keeping his distance from the president since his press secretary tested positive.
I haven't seen Mike Pence, and I miss him. I guess we said for a little while we'll stay apart because you don't know what happens with this very crazy and horrible disease.
This was the president's first public appearance since the stark warning from Anthony Fauci about states reopening without meeting federal guidelines.
There is a real risk that you will trigger an outbreak that you may not be able to control.
The president bristled a bit when asked about that.
Look, he wants to play all sides of the equation. Some governors and some perhaps partisans, maybe for election reasons, don't want to have their states open. And then some shouldn't open them quite yet. You know, they're not ready. They went through a lot and they're not quite ready. But no, we're opening our country. People want it open.
The president was asked what he meant by saying Dr. Fauci plays all sides.
When you say Dr. Fauci is playing both sides, are you suggesting that the advice he's giving to you is different?
I was surprised by his answer, actually, because, it's just, to me, it's not an acceptable answer, especially when it comes to schools.
So let's get right to John Karl with us live in Washington. And John, I know all of this comes as the president wants to signal himself that America should reopen now, traveling to Arizona last week where we sat down with him, of course. And tomorrow he's back out again, this time in Pennsylvania. And not surprising to you and me, John, that these are key battleground states for the election. But taking on Dr. Fauci could also be tricky because Dr. Fauci, at least in the polling, shows he's trusted by the majority of the American people on this.
Well, David, there's certainly a public health risk in disregarding the advice of the nation's or the government's leading expert on infectious diseases, but there may also be a political risk as well. Dr. Fauci has emerged as the most trusted figure in America on questions related to this pandemic, and in one poll out just this week, nearly twice as many Americans said they trust Dr. Fauci when it comes to coronavirus than they say they trust President Trump. David?
John Karl leading us off tonight. John, thank you.
Okay, and there you go on that video and that report. And thank you for watching this Thursday evening edition of the Riley King Newscast right here on the Riley King Network. Have a great rest of your Thursday evening. I'll see you back here tomorrow for another newscast. And I'll have a news report coming up in a little bit. Good night and bye, everyone.